Hey guys, it's Matt from 5 Dog Physiotherapy and Sports Injury Centre. So beautiful sunny weather outside today, so I thought I'd just come for a little bit of a walk. Have a really important subject that I wanted to speak to you about today, which is ACL tears and can they be managed without surgery? So do you have to have surgery or can they just have rehabilitation? So I guess this is a really important subject at the moment. There's lots of research being done on this, both to help people that do have surgery get back to sport and life as quickly as they can, but alternatively it's also really important for those that want to try and get away without having surgical management. Now, very topical, and there's lots of conjecture as to which way to go. I guess the first thing that we'll commonly see, if you are watching, please press like below. Hey Andrew, how are you, mate? Lovely to see you there. Listen in, you can hear some really cool information. So basically, if people tear their ACL, hurt their knee at sport, they'll commonly go off and see their doctor, who will arrange an MRI and send them straight to the surgeon. Now, surgeons these days are a little bit more conservative, and I'll often say, listen, you need to go straight to the physio and you need to do some rehabilitation. Now that can be for two different reasons. I guess the first reason is pre-operative management is amazing. There's lots of research around there saying that basically 5 weeks of pre-operative physiotherapy is really critical to help improve function and get people back to doing what they need to do. But more than anything, I guess, prepare them for surgery. So initially, pre-operative physio is about getting people walking normally, getting all of their movement back, getting rid of their swelling, ensuring that we can get them starting to activate those muscles and also start to improve some of their strength. Now, typically at that 4 or 5 week mark, the surgeon will reassess their patient, and from there, they may decide whether surgery is indicated or not. Now, I guess, what are the key indicators? And that's probably the big question for those people that don't want to have knee surgery. And I guess one of the big indicators is that you're now stable. So your knee is not giving way when you're walking down the street. You're starting to have really good muscle activation, really good muscle control. And this is allowing you to start to do the things that you want to be able to do. So you might be able to start jogging lightly, or you might not be back at sport. But I guess with this conservative approach and this pre-operative approach, it allows people the opportunity to not have to go straight down that surgical pathway. I guess once you've had surgery, there's no real turning back. However, what I'm noticing a lot of the surgeons are doing is they're getting people to do this prehab physio and then doing this review session to then decide, are they stable? Will they cut it? Can they make the grade and not have to go down that surgical road? Now, what are the pros and what are the cons? I guess the biggest benefit of not having to have surgery is that you can basically get back to sport within a couple of months, maybe 3 or 4 months, as opposed to post-surgery can take 9, 12, even 18 months to really get back to sport. So that's probably the big factors. I guess the one really important thing is that people do get back to the physio really quickly so that they can get all that initial management and strength and functionality about their knee, and that really does help provide a great outcome either way. Now, if you have injured your knee and you want to find out a little bit more about this topic, we've done a recent blog. It's called I've Injured My ACL, What Do I Do Now? So make sure you click on the links and have a read of that blog. Some really valuable evidence in there supporting both arguments as well. If you have injured your knee or you've got a sports injury, you've done your ACL and you need some help, please give us a call in the clinic, and it's 97132555. Matt down here at one of these parks in 5 Dock. Alternatively, if you do want to book online, follow the links and you can do that also. Hopefully you've enjoyed this content. If you have, please like it and share it with some friends, or even tag a friend that may need to hear some of this advice. Matt here at 5 Dock Physiotherapy and Sports Injury Centre. Cheers, have an awesome day.